All right. Hi, everyone. My name is Yusra Iftikhar, and my gender pronouns are she, her, and hers. And I am your Student Assembly Director of Communications. Welcome to APTA Live Student Night. Tonight, I'm joined by psychologist Dr. Laura Finkelstein of Marymount University. We are going to be talking all things mental wellness and self-care. Go ahead and shout out your name, your year, and your program down in the comments and ask your questions for Laura in the comments below using the hashtag APTA Live to join the conversation on Twitter, where you can ask questions as well. Laura, thank you so much for being here. If you wouldn't mind, please go ahead and introduce yourself to the audience.
Hi, everyone. Thanks, Yusra, so much for having me. I'm Dr. Laura Finkelstein. My pronouns are she, her, hers. And I am currently the Assistant Vice President of Student Health and Wellbeing at Marymount University in Arlington, Virginia. And I'm a psychologist.
So how long have you been a psychologist?
I've been a psychologist since 2014. And so, in addition to my work at Marymount, I also have a small private practice. So, I see about 4 adults and couples on evenings throughout the night. So, my role at the school is more administrative, but then in my private practice, obviously, I'm seeing individuals dealing with a range of concerns for therapy.
Gotcha. So yeah, so like you said, range of concerns, and it seems like range across the lifespan as well. Seeing people of all ages kind of at a lot of different points in their life. So that's pretty interesting, and I'm sure really insightful as well. So can you tell me a little bit more about what is it that graduate students, since most of our audience is going to be physical therapy students and physical therapy assistant students, what is it that students at that point in their life typically come to counseling for?
Yeah, absolutely. So I would say the number one concern for sure is anxiety or stress. Whether related to, being a student or relationships with family members, friends. PT in particular, I know at our school is highly competitive. So we get a lot of students who are probably prone to anxiety. Anxiety is a funny thing because to some extent it really helps us to succeed and to try hard. So often if you're getting into one of these selective programs, that might be part of the fuel, and a certain amount of it's really healthy. But then, we see some students who it just keeps increasing to a point where it starts to feel unmanageable, and then they'll come to counseling. So that's number one: anxiety and just stress in general. Depression also, we see a lot of students with depression at our school, and I know that's probably the number two in general in the nation right now. And then relationship issues. See a lot of students struggling with concerns with partners or roommates or family issues, and they come to counseling to work on those. So those are our top three.
Gotcha. So when people typically come to counseling, do you feel like for the most part they know that it's depression or anxiety, or um, is that something that you feel like they more so discover throughout the process of talking with their therapist?
Yeah, that's a really good question. I would say it's mixed, maybe roughly half and half. I think the older individuals I see, and more so grad students than undergrads, tend to have some self-awareness of, I think this might be depression, or they haven't been feeling like themselves. So they've looked up the symptoms, or they've talked to people, and they're potentially self-diagnosing before they come in, more so than some of the undergrads who are a little more confused about what the symptoms might be.
That makes sense because so I've been to counseling quite a bit over the past 6 or so years. And I remember one time going to a counselor, I think she was like my fourth counselor, and going in knowing that I was dealing with anxiety and knowing that that's what I was there for. And at one point, she asked me, "Do you think you're depressed?" And I remember feeling so frustrated by the question and just thinking, like, no, you need to focus. Like, we're here to talk about this. No, I'm not depressed. Like, I'm good. I've got a lot of friends. I've got my family here. And then going home that night and being like, I think I'm depressed, and having her help me to come to that realization. So it is interesting to have gone through kind of both sides of like self-diagnosis and feeling pretty good about knowing what's going on, and then also having a professional there who has obviously seen a lot of people who've been through this before to be able to recognize those signs. I do have another question that kind of comes from personal experience. So you mentioned that a certain level of anxiety or a certain level of stress can be healthy and can drive you. I've always struggled with thinking about that, thinking about, well, it's my stress and my anxiety and knowing that I want to help other people with that that's gotten me to this point. But I don't know if I'm supposed to be grateful for that. I don't know if I'm supposed to be grateful for my mental health struggles. So, do you ever talk to people who struggle with that back and forth? And what would you say to someone who does?
Yeah. So, sorry, can you clarify that for me a little bit? So,
Yes.
feeling grateful for having the anxiety because it's fueled you, that kind of thing, or no?
Yeah, yeah, exactly. So, should I be grateful or should I be upset that I've had to go through the struggle to now get to this point? So, feeling like, yes, I'm glad I had the stress or the anxiety because it fueled me and it got me into this program. But now I'm upset that I had to go through that and I'm still going through it.
Yeah. Yeah, that's a really nuanced, good question. I think that so much of our mental health is about the narrative we create around it. So, we might have a lot of struggles and feel resentful for it, and I think that's understandable. And certain people and life circumstances are more difficult than others, and I think it's totally fair to feel upset by that. But I do think that some people are able to kind of go back and recreate that narrative somewhat and say, this was a really tough time, but it's made me more empathetic. It's made me better at my job. I feel stronger because I've gone through that. So I think it's, yeah, whatever narrative kind of fits for you and makes sense with your personality and with your experiences.
Yeah. Thank you for answering that.
Yeah.
Um, so staying on this topic of counseling itself, I want to go back to kind of the basics of even seeking out counseling and what happens when you get there. So I was wondering if you could first tell our listeners a little bit more about how they might be able to find professional help in this time where we aren't all back on campus and can't go to our counseling services on campus, or we're not able to go in person to see a therapist.
Yeah. So there are a couple of options, and I think, COVID has made it more difficult to some extent, but also, in my networks, I'm aware of a lot of therapists who are still seeing new clients and still open, and potentially more so because they're offering virtual appointments. So, I mean, the two major outlets I would say is one, check with your school. Most schools right now are still doing virtual appointments. And so you can email them or call and they'll tell you how to set that up. I think additionally, some in the fall will start doing in-person appointments. You would just have to check with your school and kind of your program and what they're doing. But we all as therapists are really aware of the need right now, to some extent, an increased need in mental health
Right.
services. So everyone's really trying to make themselves available. And then if you're wanting to see an outside therapist, I always just say go to Psychology Today. That's the best resource online. It's all over the country. You just go to that website, type in what you're looking for. You can check off kind of your symptoms and potentially the demographic of the counselor you're looking for, and they'll match you up with a few, and they can tell you which ones take your insurance too. So I would say, don't be discouraged by everyone going virtual. Therapists are still very much working and wanting to help. And I'd encourage you to check out resources if you're at all interested.
Yeah, I was asking on Twitter what everyone's favorite self-care tips are, and I noticed someone from Duke actually mentioned that she has phone calls with her therapist, and I thought that was really cool because how much more convenient could that get too? So I think that's great. So okay, so I've established that I want to seek out counseling. I have this appointment set up. Now, what might that first appointment look like for a student?
Yeah. So the first appointment, generally a therapist will kind of give an overview about what therapy with them will look like. And I would encourage any client to, to ask questions to get a sense of the style of the therapist. Some people prefer more of a kind of listening, supportive type role for their therapist. Others, want really concrete things to do. So you can ask those questions of your therapist for sure. The first session, we would also go over confidentiality and what that looks like, and then go into what we call an intake, but it's basically just sort of an initial interview with a lot of different questions about your background and your presenting concerns, how long they've been going on for, that kind of thing, to get that initial picture. But you don't have to, come up with all the answers in the first session. I know that can be a little daunting. Hopefully there's sort of a flow to it. And I'm always learning about my clients, throughout therapy. So you don't have to feel pressure to answer everything. But generally by the end of that session, you'll formulate some kind of goals and what you're looking for. And the therapist will let you know if that's something that they feel that they can help you with. And if not, they would refer you to someone who might specialize in a certain area. And also, I would encourage anyone wanting therapy to, if you don't click with your first therapist, to just kind of shop around, as we say. There's really nothing wrong with that. And the absolute most important thing is that you feel comfortable with your therapist, you feel seen, you feel able to be totally open and yourself. So if you're not feeling that for whatever reason, we don't take offense to that as therapists. We really encourage, find someone that you feel like you can really be open with and feel not judged by.
Yeah, I think that's such an important point too, because I know I've personally definitely been in stages of my life where I've said to my friends, well, therapy just doesn't work. And then we have to kind of talk through, well, why does it not work? And I've had all of my therapists say, you are more than welcome to work with another therapist. And me being such a people pleaser and not wanting to make it seem like I didn't want their help specifically, I think has held me back in the past. So I'm really glad you made that point too, because it is okay if the first person you're with or the 10th person you're with is not the person for you. There might be a different counselor out there who is best suited to your needs.
Definitely.
Great. So when you do see students who are in these high stress situations of a PT or a PTA program, do you find that students are pretty forthcoming with what they've got going on? Are they pretty likely to seek out help? Or as people who want to help other people, do you feel like we hold back and we feel like we're supposed to be able to handle all this on our own?
Yeah. Well, I think you answered that perfectly in the question. I would say it's pretty split between those
Okay.
two camps. Definitely some of the PT or PTA students I've seen are super motivated. They know what they want to work on. They come in really clear on, what the issue is, and they make a lot of progress because of that motivation. And then I would say the other camp is pretty hesitant to go in, feels like, and this is not just PT, I think this is a lot of the helping professions. I know for psychologists, my colleagues have felt similarly, and which is ironic given that we're therapists.
Right.
But, as a helper, it can be hard to, I don't know, to see yourself not as a helper, but as someone in need of help, which we all do at one time or another. So, um, yeah, I mean, I do think that sometimes comes up for students where they feel like they can do it all on their own. They don't need help. Maybe there's some perfectionism there, and it feels like somehow they haven't gotten it all figured out if they need to ask for help. So I think we see both of those. Yeah.
Right. All right. And then in terms of people who want to actually figure out um, whatever I'm dealing with right now, is this a momentary, fleeting thing, or is this something that I should seek out professional help? Can you go over a little bit about what are some of the signs of maybe professional burnout or just anxiety or depression or any of these big issues that you mentioned earlier?
Yeah, for sure. I would say one thing to really pay attention to would be, do you feel really not like yourself? Because, by the time students are in grad or undergrad, at that point, you've been sad. We've all been sad. You've been anxious. You
Right.
know what those normal feelings are like. But it's really once it starts to feel really different for you that I would encourage people to seek help. And that could be because it's more intense than usual. It could be
Hmm.
because it's more prolonged than usual. Usually when I'm sad, it lasts a few days, but this time it's gone on for a month. And I know that's not my typical. So I
Hmm.
would look at those things. Also, Sometimes we're able to really tie our mood to a specific event. Like, I failed out of this class, so it's clear to me I'm sad because of that, for however long. But sometimes
Mm-hmm.
there's nothing that we can tie it to. It's just a general feeling of anxiety or sadness. And I hear all the time with clients, like, I don't know why I'm feeling this way.
Mm-hmm.
And those are also times that I would say therapy can be really helpful, and it might signify more than just the sort of general moods.
Got it. Do you feel like therapy is something for everyone, even people who are dealing with anxiety or depression? Do you feel like every single person could benefit from coming to counseling?
Yeah. Hmm. I think everyone could benefit from it, but I think that's different from feeling like everyone needs it. And
Mm,
probably different therapists would give you a different answer for this question. But, I've definitely seen clients. I'm seeing one right now who came in for a very specific thing. We worked on it, he fixed it, and I shared, and generally therapists will share with clients, like, I don't think you need to go to therapy right now. If you want to keep talking about some of these things, this is a space to do it, and I'm happy to keep seeing you. But in terms of the initial issue, I think that you've dealt with it, because I think that can be equally important. Just recognizing when you don't need therapy, because that
mhm,
also builds confidence and resilience. I never want to tell clients, like, you're going to have to be in therapy, for this amount of time, because you
mhm,
just don't know how they'll figure things out and start to feel better. And we want to really empower people to feel good without their therapist also, and not
mhm.
necessarily feel dependent on a therapist.
Sure. So, how do we this might be a big question that kind of goes beyond the scope of this interview, but how do we normalize going to counseling, and how do we normalize asking for professional help and taking medications if we need it for these issues when there is such a big stigma attached with poor mental health?
Yeah, I think there's probably a few ways, but you did one really nicely in this interview, which was you shared your own experience of going to counseling, and I think that's one of the most powerful things we can do. I've been to counseling as well, and I'll share that with friends and family as I'm making a recommendation that they could benefit from it.
Mm,
So I think sharing our own experiences is really powerful in helping normalize it. Um, I'll also talk to people about the range of things that you can talk to with the counselor. So I think less so now. I do think the stigma is decreasing, but it used to be especially that people felt like you only go to counseling for a really severe mental health concern. And that's just not the case, especially the students I see. There's such a range. And
right,
just letting everyone know, you can go because you had a bad breakup. You can go for so many reasons, and it can be helpful.
right.
Um, and yeah, I think just societally, I feel like it's getting more and more out in the open. I know there's um, some professional athletes who are doing some good work around talking about their own mental health struggles, and some celebrities. And I do think that has an impact, for us to see
Hmm.
people who seem like they really have got it all together, saying, this was a helpful thing. There's no shame in going to therapy.
Yeah, that's great. Um, and and I remember too one time talking to someone who um, felt like they maybe wanted to go to counseling, and just I've actually had multiple friends, actually, now that I think about it, say, I think I should go talk to a counselor, but I have no idea what to talk to them about. Like, I don't even know what I would tell them. And I was like, honestly, counseling can be a great place to just go vent. And it's an unbiased third party that you can use names with, and they won't tell anyone. And so I've had friends use that kind of as motivation too. And then, of course, talk through maybe some deeper things that are going on in life. But yeah, yeah, I just remember having that conversation being like, hey, if you don't feel like you can vent to me, like, there's people who are trained to help you talk through kind of whatever you're going through right now.
Yeah.
Um,
Most people to some extent like talking to someone about their issues. It's just a really
mhm,
normal human thing. So whether
mhm,
they're doing it with their friends or family, this is just another person to listen in a different kind of way. And when we think about it that way versus some like radical, totally different kind of experience, it can help people a little.
Yeah. So with me being Pakistani and me being Muslim, sometimes in those circles, it's not as common to seek out professional help. Like you said, the stigma is definitely going down. It is so much more common now. But I remember having some conversations with people in my community where they felt like either there were other ways to fix issues, like solely relying on faith, for example. So, do you see any of that? Do you see any students maybe from cultures that aren't primarily American, or faiths that aren't mainstream that struggle with either coming to counseling, committing, or finding benefit?
Absolutely. I would say that, you know, our identities and cultures are so impactful in relation to how we think about mental health, the type of help we might look for. That, yeah, at every stage, thinking about it, going to it, and benefiting from it, I think that has an impact.
Hmm.
And, the way that therapy kind of came about in this country was through a predominantly white male older lens. So, there's a lot of psychologists who are really aware of that and working to make it feel more inclusive,
Hmm.
and not just operate from that specific lens. But I do think it's kind of baked into what the process is. That said, I personally have seen students and adults from all different backgrounds and cultures, races, genders really benefit, even if I would say the biggest discrepancy is that initial desire to go into counseling. And
Okay.
generally, I've seen it be beneficial across cultures.
Yeah. Great. Uh, okay. So say we may not feel like we need to go to counseling, but maybe there's a friend or a classmate, or for the clinical instructors or the faculty who are listening, their student who they feel like could benefit. How do we go about suggesting that to someone in a way that's not threatening and that's not even more isolating than they may already feel?
Yeah, so I would say the first step is to really listen to the other person. I think when we jump too quickly into, oh, you need to see a counselor, A, we might not know the full picture, and B, I think that can be off putting to people, just to kind of get that reaction initially. So I would say first, listen, try to understand, see where the person's coming from. And then I would just say in a very gentle but direct way, I think therapy could potentially be helpful for you right now in working some of those things out. And I think our fears about how that's going to sound are often greater than how it's actually
Mm,
taken by the other person. I've actually had the opposite experience often of people saying, um, you know, I think I will go, or thank you for it. Shows that you sort of are aware of the magnitude of what they're saying and you're taking it seriously. So I think it can have a really positive impact on the relationship too. So that's what I would say. Just kind of jump in and go for it. And I think for the most part, people are somewhat receptive.
yeah. I have two stories to share. I feel like I'm doing a lot. I feel like this is a lot of like me sharing today.
Good.
This is a topic that's so close to my heart, but I had that conversation a little bit with one of my clinical instructors where we talked about, you know, with me being their student, like, do they immediately contact my program and say Yusra struggling, and do they immediately try to find me counseling, or um, do they try to still see me as their student and still try to see me as a friend? Because I know in the past I've felt kind of overwhelmed by other people's mental health issues once like a label gets put on it, and me thinking like, oh, I'm not a professional, I'm not, trained to help them with this, but then thinking, well, this is still my friend, like this is still my family member, we can still talk about this stuff, I know they're safe because they're sitting here in front of me. And then once we talk it out a little bit, maybe talking about next steps. And then the other story was one of the people I'm most grateful for at my program at Duke was my advisor. And he's someone who has done both. He's suggested that I go to counseling and help me get that set up. And he also, one time, I went into his office and I said, I just need to vent. I need you to not say anything, and then I'll go to class. And he's like, okay. And he sat back and I vented for 2 minutes and I said, I feel so much better. And I just went to class. And that was all I needed that day. So it helped that I had been through counseling a little bit to understand that that's I didn't need to set up an appointment at that point. I just needed to get some things off my chest, but I appreciated that he was there for me in so many different ways, but especially that day, especially somebody in power and my advisor, to just say, okay, I won't say anything at all. You know, you're kind of running the show here. So I really appreciated that. All right, let's see. So we've got some questions here from Facebook. Okay, I'll read it out loud. It says, as physical therapists, sometimes we can be a jack of all trades, not just treating patients for their physical conditions and mobility, but also offering advice, informal counseling, and self-care. In your career, have you noticed any particular signs in which healthcare providers like physical therapists or physical therapist assistants should refer the patient to a psychologist or a psychiatrist?
Yeah, what a great question. And I do feel like, there's certain jobs, physical therapy, I think a lot of the caregiver type jobs, also like hairdressers, a bunch of different jobs where you end up almost falling into this counseling role at times if you
Right.
have a good relationship with your patient or client. So I think that's something that is fairly common. And it's a really good question because both for the person, the other person, and for yourself, you want to know kind of what those boundaries are, like how much you can support and offer your own advice, and at what point you think that they should go see a professional therapist.
Right.
So I'm trying to think like what the specifics to look for. Definitely any kind of really severe threat of, like, if there's any sort of suicidal
Mm-hmm.
references, or any kind of like abuse or trauma that
Mm-hmm.
a person references, I would say for sure those would be, you'd want to make a referral at that point. I would also just kind of check in with yourself in the process. And if you're feeling really drained, if you're feeling like, I'm trying to give all this advice and it's not working, or, every time
Mm-hmm.
we have a session, it ends up being about mental health, that's a pretty clear sign to me that they probably need someone who's trained to deal with those issues.
Mm-hmm.
Um, so those are the biggest things that come to mind. I don't know if that's a great answer. I'll think
No,
more.
that definitely, yeah, that definitely helps. And I think I also too used any sort of point I felt like I was getting a little bit overwhelmed and just unsure of what to do as an indicator of maybe there was another professional that I could work alongside during my clinical rotation. So those were, I think, some of the most important conversations I had with my patients at that time, were to be able to identify where they could find counseling. I ended up making a list for them based on some places my clinic had referred in the past, some places that I had found, and I loved that a lot of my patients really did latch on to the idea, because then they felt like they were getting that part addressed in counseling, and then they could also have of course, like, daily stressors and things that are within our scope to talk about, but also then the physical component in physical therapy as well. So it ended up working really well, and it's a great way too for PTs and PTAs to form those relationships and connections with other healthcare providers outside of their clinic or within their hospitals or wherever they're working.
Absolutely.
um
I think
yeah.
it just made me think too of, once you have those relationships with other, if you can have relationships with therapists, for example, you could potentially consult too, just, give a
Mm.
call and say, this is what, my current patient is talking about. Do you think it would be helpful if they saw someone to sort of bridge that gap that way?
Right, that's a great point, because then I bet one benefit too is that counselor can then say, "Oh, I have a friend who treats this,"
For
versus just
sure.
kind of throwing your patient into the wind and saying, "Go find a counselor." You could say, "Well, if they're struggling with an eating disorder, like here's where they can go for this." Yeah, okay, great. I love this. I love this conversation. We are going to take just a 1 minute break, just for a couple of announcements, and then we will get back into talking about mental health and self care. Alrighty, friends. So registration for APTA Next is open through the end of July. It's $20 for members, which is a great deal. And there's a lot of really good content on there for anyone who wants to check that out. Also, APTA has a new website. So if you haven't gotten to take a look at that, I think it's really beautiful. You can do that at apta.org. And while you're there, you can read up on the latest blog posts. I have one on there about imposter syndrome and my journey through mental wellness. I know that there's a podcast episode about imposter syndrome as well. So lots of really great content on the website, and we are always looking for writers for the APTA blog. And you can submit your draft or your post idea to pulse@apta.org. Alrighty. let's get back to talking about this. So I do still want to talk about counseling, because I know that's what we talked about heavily for the first half, but also just getting into more general mental health, mental wellness, and self-care. What about those of us right now who can't access counseling during this time or have given it a shot and they'd like to try something else? What would you say are your top tips for maintaining mental wellness during this time of COVID, licensure exams getting canceled, no jobs, and more?
Yes, absolutely. There's so many stressors going on right now in the world, and I think in particular for students and for new grads. So a couple of my tips, I would say for one, just really accepting your emotions. I think that's something that can trip us up is where we feel like we can't feel anxious or we shouldn't be upset. Kind of paying attention to any time we say shouldn't is a good way of testing that out. It's kind of like cognitive behavioral therapy for those of you who might know about that a little bit. But paying attention to when we're saying those things to ourselves, and just giving ourselves some self-compassion. I always think about, what would I say to a friend who is in this situation?
Mm,
And I should be speaking internally to myself in the same way. So, if you think about like the top three negative thoughts that you say to yourself, and then imagine saying them to someone else, most of us will think, oh my God, I would never say that to anyone else. So
right.
that tells you that you shouldn't be saying it to, well, I said shouldn't, but so you try not to say it to yourself either. So I think at this point, self-compassion and understanding and reframing those thoughts really go a long way. And if that resonates with you, that idea, there's tons of things online and different books that can help you really rework those thoughts. So I would say that is number one. The I think we all are online so much now, with good and bad to that, but there are a bunch of really great apps that can help. Headspace and Calm are two of my favorites, and they have different relaxation exercises and mindfulness exercises, and I they're really practical, and I think can be good for people who are sort of new to the therapy space and don't want really in-depth things, but just want some quick tips and tricks. So I would say that finding support. So if you're not able to see a therapist, just thinking, who are the people in your life that feel supportive, and maybe it's family, maybe it's friends, maybe it's pets, and talking to your animals, which can be almost like a therapist sometimes because they really listen.
Yes.
um, but finding a way to really get some of those thoughts and feelings out. If no one comes to mind that you feel that you can share those things with, journaling is a big self-care tip that a lot of people find helpful. I'll
Hmm.
sort of pause and say that I think there's no one size fits all for self-care, and if you do some research on it, they always talk about the same kind of 5 to 10 things, but
Hmm.
if it works for you or not. And self-care is not something that you want to force. So if like physical exercise is just not your way of feeling calm and relaxed, then don't put another should on yourself and say, well, I've got to do this is going to make me feel better. So just trying to find what those things are. And I do think for a lot of us, it's like a challenge to find what our self-care things are. It's not as easy as like, oh, I'll light a candle, I'll take a bath, because maybe those aren't
Hmm.
things for you. So it takes a little bit of kind of exploration, especially in the stage most of you are at right now. You're so used to just being work oriented and motivated in that way that you might not know what relaxes you. And that's okay too. That's
Right.
perfectly fine. But
Right.
it's a journey worth going on, just kind of figuring out like, what is it for me that makes me feel good.
Yeah. Gosh, there's so much good stuff there that I want to reflect on. So one of the things is, yeah, absolutely find what works for you. I've taken mental health days and tried self-care routines that leave me more stressed, because I am someone who likes to be productive. And if I have an entire day off and do literally nothing, that's not relaxing for me. So I've found other ways to be productive, like writing for my blog or like helping my parents around the house, that still make me feel like I'm doing something, but taking a break from what's actually causing the anxiety. You mentioned Calm and Headspace, two really great apps. And I think for me, Calm was really great because it helped me with my sleep. So I've always been in that camp of like, I don't like to meditate. You can probably tell that by my personality. I'm just not someone who sits still very well. But I was having a lot of trouble falling asleep, and they have like guided meditations for sleep on there that I found really relaxing, and it helped me a lot with the stress that I was having during my clinical rotations. My friend Taylor actually reached out to me on Instagram and mentioned the app Smiling Mind. Have you heard of this one?
I haven't heard of that one.
So
Smiling Mind.
I hadn't either. Apparently, it's an Australian app and it's comparable to Headspace, and it's a completely free app. So thank you, Taylor, for pointing that out. I think that's really great. You mentioned that there are some books that can help you to work through some unrest or some stress. Do you have any that come to mind that you would recommend to the viewers?
Yeah, I was just reminding myself before this podcast because there was one and now I'm going to forget the name. I think a better use of our time is let me find a couple of the books for you and then maybe I don't know if there's like a companion piece on here where I could include some of them in there.
We'll get it out to everyone. No worries. That's perfect. Okay, we've got a question here. We were just talking about some tips for managing anxiety during this time. We've got a question specifically about studying for the licensure exam. A bunch of us just graduated, and our licensure exams are kind of all over the place. Mine was just canceled on Friday, so now I have to figure out when I'll take it. So it's interesting to try to figure out how to study when there's not only we're in quarantine, but all the racial injustice and trying to make sure that we're being anti-racist and working on that part of our lives as well, while trying to study for potentially the biggest test of our lives. So do you have any test studying tips or tips for taking breaks from studying, anything at all?
Yeah, I mean, the first thing that comes to mind is definitely taking breaks. And so much of the time, what I hear from students is, I just can't take a break. I do not have time. And I will gently challenge that because everyone can take some breaks. And it's really healthy, not just for your mental health, but in terms of your ability to succeed on these tests, you've got to take a break. So, allowing yourself to do that, not feeling guilty when you take a break. Maybe you schedule your breaks beforehand so that it feels better, but also just kind of doing the things you enjoy. I think the sense I get sometimes is people feel like they've got to invest so much in these other things that almost there's some guilt in feeling content or happy or doing something fun. And I would say try to not give into that guilt and to realize like if you can snag a happy moment in the middle of the day, that's great. Enjoy it, let yourself be in that moment, and the rest will benefit. So trying to build in breaks, again, trying to really normalize those feelings as you're getting stressed or upset. These are what so many people, everyone is feeling right now, so it's okay to feel that way. You might find it helpful to, well, I think connecting with other people in a similar situation, it can have mixed results. Sometimes it heightens the
Mm,
anxiety, but sometimes it's really normalizing to hear like, oh yeah, all these people are also struggling with this. So
right.
yeah, and I think too, I guess I have the luxury of saying this now, having done all those exams, and even though it makes me anxious even thinking about them still, but you do get to the other side, and it's really just a moment in your life, even though it can feel like, when is this going to end? And this is the biggest deal, that will ever happen to me. It will pass over time and you'll get through it. So trying to remind yourself of that
Sure. I am so guilty of all the things you said about not wanting to take breaks and feeling that guilt. So, how do you encourage students to prioritize that self care, even when time seems so limited? So, taking breaks is one thing, but then if I see taking a break or feeling that moment of happiness as secondary to everything else I've got going on, is there any way for me to flip that and prioritize my mental wellness over all else?
Yeah, it's a really good question. I mean, part of it is, yeah, almost a shift in our minds to what the priorities are. And I always feel like, if mental health isn't even just at a baseline, it's hard for anything else to be productive. I
Hmm.
think, also sometimes for my students who are maybe more perfectionistic or working all the time, it's helpful to almost consider the breaks and the self-care like a to-do, something on your to-do list,
Mm-hmm.
so it's on the list, you have a certain amount of time for it, and you won't succeed unless you're taking
Right.
that time. So almost like channeling what is already sort of a natural disposition and strength in some
Mm-hmm.
ways, and saying, oh, this is on my list, I got to get this done, along with reading this chapter or whatever it is.
That's perfect. I love that. Um, so with us being in quarantine right now, with a lot of us kind of on the hunt for jobs, wondering whether we're going back into our clinical rotations, it's a big time to be on social media. I'm on social media a lot. And in some ways, it helps me to feel connected. I'm in Southern Indiana here. I'm pretty far from North Carolina and all my friends there. But then on the other hand, social media can be such a highlight reel of everyone's lives. And then you find yourself comparing yourself and then maybe feeling worse. So do you have any advice related to social media use for students in this time?
Yeah, well, the highlight reel is a really good point. I think that always bears repeating, um, because we do get this certain version of people on social media that is not an accurate representation of what everyone is going through. So being
Mm-hmm.
aware of that. Also, oh, I just lost my train of thought. Oh yeah. So I think that social media, I don't categorically feel like it's a negative thing at all. I do
Mm-hmm.
think, it serves a lot of purposes, and it can make us feel good and laugh. And there's so many benefits to it, especially during this time. So I guess what I would encourage is sort of mindful social media watching. So just trying to be aware of when you're on social media, looking at certain things, how are you feeling? Check in with your body, what thoughts are going through your mind, because I think for so many of us it's almost, we just go to it without even thinking, and then we're scrolling, we're not even aware of how we're feeling, which might be, more sad, jealous, a range of
Right.
negative emotions. So just being aware of how you're actually feeling and doing the things that feel good, maybe looking at job related things is anxiety provoking, or maybe it feels productive and good. Maybe
Mm-hmm.
seeing friends is makes you happy and connected, or makes you feel far away. I think it could be really different for different people what emotions it brings up. So
Mm-hmm.
just trying to check in on what feelings it brings up for you, and do the ones that make you feel good, and try and avoid the ones that don't.
That makes a lot of sense. I'm on social media a lot, just as the director of communications, it's part of my role, but also it's just something that again makes me feel productive with my blog that I have. But then I certainly have other days where I just leave my phone in my room for the entire day, and those days are the best because if I don't fill every last second with scrolling through Twitter, I'm inevitably going to fill it with either reflection on something that I want to think about, or just spending time with family. So, yeah, I'm glad that you talked about how social media is not like the most evil thing, and we should all just avoid it, because for some of us it is really helpful, and that is how we're staying connected in this time. But doing it, or I guess checking in with yourself as you're scrolling through social media, yeah, that's great. Okay, in this last little bit, I want to touch on too for any faculty members or clinical instructors that are listening, maybe some advice for them. You mentioned before this interview that sometimes faculty may feel a little bit overwhelmed or uncertain of what to do if a student comes in their office and just breaks down in tears. So, what would be your advice if that were to happen?
Yeah, so I work with a lot of faculty and staff at Marymount, and they're wonderful, and they're always really wanting to do the most supportive thing for their students. And a while ago, the education with them was more around how to, when to refer to counseling and how to do it. And they're really great at that now, and they know when and how to refer, and they do it all the time. I think the nuance is also just when to not refer, when to
Mm-hmm.
really just be able to sit with a student, listen to them cry, listen to them vent, like you had shared in your example. Sometimes they might outline it for you, but sometimes it might just be a spontaneous reaction, and just, you know, all of us kind of reminding ourselves all those things are so normal. Sometimes
Right.
students get overwhelmed and they just need to cry. They need to talk about it. That it doesn't mean that there's any risk necessarily, or that they need to
Mm,
immediately seek counseling, and the students I've worked with have really appreciated when a professor or staff member has taken the time just to listen, normalize. You don't have to do anything in the moment, which I think is a misconception. When people come to us, we feel like, okay, how do I make this go away? Where do I refer? What do I do? Really,
Yep.
sometimes, a lot of the times, we just need to be listened to and heard, and shown that it's normal, and not have the other person get really anxious just because we're having a different emotion. So I would say that that would be my recommendation. Faculty and staff, just like everyone, we're all human, and they are going through their own stuff too. So I think, for them, my advice would be similar to everything we've been talking about today: taking care of yourself, because we
Hmm.
can, absorb a lot of the emotions of our students, and feeling good enough internally that you're able to just have that space to sit with a student for a little while and to hear their concerns, and then to
Sure.
know, if it's happening really repeatedly, or if it feels really severe, of course, to refer and get resources,
Right.
but not necessarily to have to jump to that.
Yeah. I alluded earlier to how there can sometimes be a power differential between clinical instructors and students, or faculty and students. Do you have any advice for those people in power for breaking down that wall a little bit so that students feel comfortable coming to them to talk about these things?
Yeah, it's a good question. I think that, um, you know, with faculty and staff, I talk a lot about being aware of their own boundaries. So knowing
Mm-hmm.
what they really do feel comfortable with, because that's different for every person. But once that's
Mm-hmm.
established, I recommend just making that really clear to students, even from, the outset of the course, just saying, you might be going through different emotions over the year, and
Mm-hmm.
I'm happy for you to come in and talk to me about those. Or, you know, I'm happy to refer you to a counselor. It's just kind of whatever is the comfort level. Um,
Mm-hmm.
and I think it's different for every individual. But yeah, just to be really transparent with students about what they can offer as a resource, I think can be helpful. And modeling that throughout. It's not just um,
Mm-hmm.
in a first class, but I've had professors and some PT professors ask counselors to come in throughout the semester and just talk about stress management or self-care.
Mm-hmm.
That's such a good example to set. Like, I see you, I understand this is going on, and we want to help address it. And it's normal to talk about these things. So really normalizing the conversation can be helpful.
Yeah. And for any students listening too, sometimes we're afraid of our faculty. And I would say that as long as, your faculty member has maybe given some sort of indication that they're comfortable talking about these things, they really may surprise you. I remember one time I went to this big conference and I was so excited about it. And I got there and I had a horrible panic attack. I ended up leaving, coming back. I had a practical coming up. So there was just a lot going on. And I went into my professor's office to talk to him about the upcoming practical and just completely broke down. And he was not someone that had ever, talked with me about any sort of mental health issues before, let alone seen me go through them. And it was one of the best conversations I've ever had. And he talked about his own struggles, and he talked about, things that he'd been through and experienced. And it was, my biases came into play because I didn't necessarily think that he was going to be like my go-to for mental wellness. But from that point on, I knew he was someone that I could trust. And yeah, the point is really just people can really just surprise you in just the absolute best ways. Um, okay, question here from Facebook. All right. So, any advice on how to manage stress and anxiety when we're worried about our kids and our spouses at the same time due to everything going on with the pandemic? So, kind of a question about just balancing everything that's going on right now.
Yeah, absolutely. Oh, I wish I had such a good, succinct answer for that. I mean, for one, we'll just say again how normal that is. I think so many of
Hmm.
us right now are juggling that. How do we take care of ourselves and the other people in our lives? I saw something recently which was talking about making a list of the things we can control in our lives right now and the things
Hmm.
that we can't. And, I think especially with what's going on in the world right now, there's so many things that we really can't control, and that can raise
Hmm.
anxiety. But identifying those and trying to move away from those, because that's the anxiety that really doesn't serve us. And
Hmm.
then looking at, what can I control, what can I do, what's an anti-racist type of behavior I could do that makes me feel like I have some impact and control? What is a safety behavior with COVID that inside my world has an impact? And trying to focus on those things versus, all the bigger things that we don't have as much control on. But it's hard. It's hard. I think, for all of us, again, in our families and work, and there's just so much going on right now. So, but also getting support that you need to, and making sure that you make some space for that, particularly if you are a caregiver at work or of other people, making sure to try and have some time where you are being cared of as well.
Sure. I'm really curious, Laura, what are some of your like self-care routines or things that you enjoy, like things that you like to do that bring you joy?
Yeah, good question. So I have a dog, which I know we were talking about before the interview, who is a big self-care for me in
Hmm.
multiple ways. One, just being around her, but also I go on walks with her, so that helps me to get a little exercise and to get outside. Definitely connecting with friends is probably my number one self-care. And because I'm a therapist, I tend to be the caregiver. So sometimes I have to call friends and say, I need your help right now. I need to,
Sure.
you know, have you listen. And I don't have any advice to give right now. I just need to vent, similar to what you said. So that's a
Yeah.
big one for me. Music is a really big one. I love music. So usually I have some go-to songs that lift my mood. So those are probably my biggest ones.
I love those. So I promised some people that if they shared some of their favorites about like self-care and how they just feel better in this time of craziness, that I would share it. So I've got a few here. So I want to thank first everyone who did reach out via social media to share these things, but and they're all great. I'm going to be incorporating all of them, but there was a lot of like people's dogs. I really enjoyed the pictures. So thank you everyone sending pictures of your pets. Helps me a lot because I'm very afraid of dogs. So we were talking about things that are out of your control. So that helps me. That's my exposure therapy is cute pictures of everyone's dogs. Exercise is a big one. So no surprise there for PT and PTA students. Eating sushi. So thanks, Caitlin, for that one. I loved that people mentioned a lot of their favorite book series. Harry Potter came up a lot. So you can tell there's a lot of millennials sending these in. And then one that I really loved was putting your phone and your computer on do not disturb, and spending time just meditating, spending time reflecting. Music's another one that came up a lot. I used to be a Zumba instructor, so I love that everyone was talking about like dancing and just spending time outside. So thank you to everyone who sent those in. All right, let's see. So we are getting close to the time. I just want to see if there's anything else that came in. So I know one thing that we talked about prior to this call was how the reaction might be different sometimes when male students either cry or express concern for their own mental health. Can you talk about that a little bit? Where have you seen that happen and how do you address that?
Yeah. So I think it goes along with our conversation of culture and identities and, the different biases that we all as humans naturally have. One bias that has been perpetuated over the years is that, men should be tough, and tough meaning shouldn't cry or should hide their
Hmm.
emotions. And it's really problematic in a lot of ways. There's a great film called The Mask You Live In, about the kind of mask of masculinity that men wear.
Mm,
Anyways, long background to say, I think as a result, when male students cry, I've found that faculty and staff can have more anxiety than when female or otherwise identified students are crying.
hmm.
It's just an association that people don't have as much. And so I think it's really important for people to check that bias and be aware
Hmm.
that, yes, men experience all the emotions just like everyone else, and
Hmm.
to not react in a minimizing way. I think the instinct a lot of the times with everyone is people saying, "Oh, don't cry." Well,
Hmm.
that's not the most helpful thing to say, right? Because they are crying, they're
Right.
crying for a reason.
Right.
And saying don't cry just makes people feel some shame around crying, I think, especially men.
Mm,
So, just a good thing to be aware of, and to be able to check if a male student is crying with you that that's normal too. I
Hmm.
I would say at our counseling center, male identified students are definitely present less than female students, and I think that's in general with therapy clients. But a lot of the male students I've worked with have really benefited from it because sometimes men don't necessarily have the same built-in social supports as women. Um, or maybe they have the supports, but it's not at such a level where they feel like they can cry or they can really share their
Mm.
emotions. So I've seen like a really quick and strong impact of counseling on a lot of our male students at Marymount. So, uh, yeah.
Yeah, thank you for touching on that. I think that's really, really important. So many different, unfortunately, barriers and stigmas associated with mental health, but I think identifying those is definitely the first step, and it's good that that we're talking about this. Well, Laura, thank you so much for being here. I really, really got a lot out of this. I hope everyone listening did too. If anyone wants to reach out and keep the conversation going, where can they find you?
Yes, absolutely. Thank you so much for having me. It was really fun, and I'm so glad to be able to talk about this with everyone. Yeah,
Sure.
so feel free to email me. My email is Dr. Laura Finkelstein, and the last name is Finkelstein @gmail. So I'm happy to respond or follow up on anything that I talked about today. Please feel free to reach out.
Wonderful. Well, thank you so much again. Thank you, everyone who tuned in, everyone who asked questions and shared their self care tips on social media. We will be back next month with another APTA Live, which will be announced very soon. And I just wish you all lots of peace and wellness during this time and hope everyone takes care. I'll see you all next month. Bye, everyone.